I have symptoms of a cold, fatigue, cough, insomnia, aches and pains for about a week. I am going to see my GP today. What can I expect from the consultation? How long will it be? In Australia, what will it cost? How long will I be waiting in the waiting room? Will he prescribe anything? How will he explain my symptoms? Will he sign me off work? What will signify that he has done a professional job?
When seeing a GP or family doctor in Australia for cold symptoms like fatigue, cough, insomnia, aches, and pains lasting about a week, the consultation typically involves the doctor asking about your symptoms and medical history, physically examining you, checking temperature, throat, ears, chest, and possibly recommending tests like throat swabs if needed. The appointment should last around 10-15 minutes. Cost-wise, if the doctor bulk bills, which few do, there may be no out-of-pocket expense. Otherwise, typical doctor fees in Victoria range around $40 to $50 gap payment after Medicare rebate. Waiting times vary widely. Urgent cases might wait several hours, while routine appointments could require days of booking in advance. But actual wait in the clinic waiting room for your appointment can be up to an hour. For common colds, doctors generally do not prescribe antibiotics since colds are viral. They may recommend over-the-counter medicines like paracetamol or ibuprofen for symptoms. If the symptoms are severe or there are complications, they may consider specific treatments. They will explain your symptoms as viral and self-limiting, suggesting rest and hydration. Regarding work, the doctor can sign a medical certificate to excuse you from work if your symptoms justify it or if your health condition affects your ability to work or if you have COVID. The certificate typically states you are unfit for work for a certain duration, without disclosing detailed medical info. Signs of a professional consultation include thorough history taking, physical examination, clear explanation of your symptoms and advice, appropriate treatment recommendations, and issuing a medical certificate if needed.
Upper respiratory tract infections or colds are a common reason for GP visits and often lead to high rates of inappropriate antibiotic prescriptions. In a nationwide Australian study involving over 4,000 URTI patients prescribed antibiotics, smartphone surveys tracked symptom profiles at 3 and 7 days post-visit. Despite antibiotic treatment, most patients reported moderate to mild symptoms at 72 hours, which improved to very mild or no symptoms by day 7. Importantly, symptom severity and recovery trajectories closely mirrored those in patients with viral URTIs who received no antibiotics. In another study, using the same dataset, the team found that the length of GP consultations where antibiotics were prescribed for URTIs varied substantially. Median consult times averaged around 11.4 minutes, but were sometimes much shorter or longer depending on socioeconomic factors, gender, day of the week, and location. This variability in appointment duration means that doctors may still prescribe antibiotics even in brief visits. It underscores why it is vital for patients to advocate for what they know is best care, asking questions and discussing treatment options openly with their family doctor. This research highlights that antibiotics do not appear to speed recovery in typical URTIs and demonstrates the feasibility of using smartphone technology for tracking patient symptoms in real time. The findings support the ongoing importance of antimicrobial stewardship, informed prescribing, and patient engagement in primary care. Patients who know that antibiotics won't help will question their prescription,